admirable acumen in all spheres of pharmacy, was recognized, appreciated, and honored by the profession by electing him.
You have muted yourself.
Apologies. Recently, Mr. Nasa was also awarded the Best Drugs Control Officer from All India Drugs Control Office Confederation. He has also been honored with the K.C. Chatterjee Memorial Award. Mr. Nasa, it is an honor to have you here with us today. Can I request Ronak sir and Vandita ma'am to make him the presenter so that he may continue with his presentation?
Good morning, Dr. Nasa. Welcome to IHM Pusa. It's so nice of you. Time in your positive ways. Thank you, sir.
Good morning.
Sorry for the presenter now. Kindly share. Yes, sir.
Can I start?
Yes, sir. Please. The
Hello.
session is open.
Okay.
Ron, session C.
No, ma'am. Presentation is not visible.
Sir, the presentation is not visible yet.
No, ma'am, it's not visible yet.
We are. Thank you. So, any issue at your end because it's showing low bandwidth at your end.
And your voice is also so distorted.
First year students, you are requested to put your things on the chat box because if you open, the whole session gets disturbed. You can put it on the chat box.
Ma'am, I'm also seeing messages for students to enter. They're requesting entry.
Ronak sir, if we can help them out. Entering of the student.
Wait for a few minutes. Let the session start.
वहाँ से ओपन करो। तो आपके एंड से मतलब वो होता है ना, होस्ट को परमिशन देनी पड़ती है ना शेयर स्क्रीन के लिए। हाँ हाँ मैम, हाँ वो नहीं आ रहा है।
रौनक सर, सर को फिर से प्रेजेंटर बनाइए एक बारी। कि प्रेजेंटर राइट्स चले गए हैं फिर से सर के पास से। वंदिता मैम, मैं आपको कॉल करती हूँ अभी, एक सेकेंड।
Ma'am, the presenter rights are back with NASA sir. Anshu ma'am.
Yes sir, I am just communicating to them. हाँ जी सर, वो फिर प्रेजेंटर बना दिया है सर फिर से। सर आप मुझे भेज देंगे, आप मुझे भेज देंगे प्रेजेंटेशन। हाँ, मेरे को ईमेल कर दीजिए फटाफट, मैं अपना आईडी भेज रही हूँ। Ronak sir, I am forwarding the presentation to you, sir.
Yes ma'am, noted. Please mail it to me.
Nasa sir, meanwhile you can start off and then we can add on the presentation. You can start interacting with the students with your experience. Yes, sir.
Just 2 minutes, 2 minutes.
Yes, sir.
You can.
Good morning everyone. Before NASA sir starts, please make sure you are on the mute. Otherwise, we'll start expelling you and you will not be allowed to re-enter. Rohit Kumar and everyone, please go on mute, switch off your cameras, let the bandwidth work.
Hello? Hello?
Yes, sir, we can hear you.
Yes, sir, we can hear you.
Please share.
I don't think this meeting is working. No, also like this only.
Ronak sir and Vandita ma'am, I have emailed you sir's presentation. I hope you have received it, Ronak sir, Vandita ma'am.
Yes, ma'am. Just sharing the screen, ma'am.
Okay, thank you.
Hello. Hello.
Yes, sir. Sir, this is Dr. Vijaya's. We need Dr. Nasa's presentation.
Hello.
Who is saying hello? Say your name also, Abhijit Sarkar.
I can't understand, ma'am.
Rajakumar, nobody is speaking right now. Please be patient. We are trying to put the things right, so please wait.
Students, we are just shortly starting off the work.
Any issue right now? अच्छा, okay. I'm just waiting. कर रहे हैं.
तो कमेंट में यहाँ लिख रहा है
Sir, please, you can start now and do let us know
Okay.
when we have to change the slide. Thank you, sir.
Okay. Thank you very much. I am audible?
Yes, sir, you
Hello.
are audible. Yes, sir, you are audible.
Thank you very much. Thank you very much. So, good morning to everyone, and I welcome all the undergraduate and postgraduate students of IHM Pusa, which is one of the reputed institute in the hotel management. And my thanks to Dr. Anshu for inviting me for this webinar today on this 15th of October in the
Pleasure is
early
all
morning
ours.
hours.
Thank you.
And also, this is my, I think, third or fourth time when I am interacting with students of IHM Pusa. So, simply I can say the topic of my presentation is, preventing the, prescription drug abuse. My introduction is that I am working with Drugs Control Department, Government of Delhi. My office is located at Kadkaduma, and you can see I have written health is wealth. अगर हेल्थ ठीक है तो सब कुछ बहुत बढ़िया है. ये एक नॉर्मल एक कोट है. And with these remarks, I will start my presentation. Next slide, please. Now, actually, in this presentation, I have shown 3 P's which are very important. One is physician, other is the pharmacist, other is the patient. जब भी हम बीमार पड़ते हैं, whenever we are not well, we go to a doctor, that is called physician. Doctor prescribe the medicine, and patient consume the medicines. So these 3 P's, pharmacist, physician, and patient, पीछे आप लोगों ने सभी बच्चों ने मीडिया में देखा कि महाराष्ट्र जैसी सिटी में celebrities were found, involved in drug addiction, drug abuse, which was a big challenge. तो सबसे पहले मैं यहाँ डिस्कस करूंगा कि ये प्रिस्क्रिप्शन ड्रग होती क्या है. नीचे एक बॉटल दिखाई है फेंसिडिल सिरप की. अगर आप नीचे जो बॉटल नजर आ रही है आपको ब्लू लेबल में, जो फेंसिडिल सिरप है, दिस इज कॉल्ड ए कोडीन प्रिपरेशन. कोडीन नॉर्मली हम यूज करते हैं कफ सिरप्स में. And these cough syrups like Fencidil or Corex, basically इनका use है, therapeutical use है, कि they are used to cure the cough. But we have seen the cases that most of the young generation is taking these syrups, codeine preparations, as a drug addiction. प्रिस्क्रिप्शन ड्रग के बारे में मैं थोड़ा बता दूं. जो भी दवाई डॉक्टर के पर्चे पे लिखी जाती है, दिस इज कॉल्ड प्रिस्क्रिप्शन ड्रग. हमारा एक सेंट्रल एक्ट है, दिस इज कॉल्ड ड्रग्स एंड कॉस्मेटिक्स एक्ट. दिस प्रिस्क्रिप्शन ड्रग्स आर ऑलवेज प्रिस्क्राइब्ड बाय ए डॉक्टर, दैट इज ए रजिस्टर्ड मेडिकल प्रैक्टिशनर. कहां से आप परचेज करेंगे? दिस कैन बी बॉट एट ए केमिस्ट शॉप इन द प्रेजेंस ऑफ ए रजिस्टर्ड फार्मासिस्ट. इट इज ओनली मेंट फॉर वन पर्सन. ये नहीं है कि कोई दवाई अगर आपके लिए लिखी गई है आप उसको शेयर करें दूसरे अपने फ्रेंड से. इंटेंडेड टू बी यूज्ड बाय वन पेशेंट ओनली, and regulated by Food and Drug Administration or Drugs Control Department. So this is brief prescription drug. एक बार ध्यान रखिएगा, कोई भी दवाई जो डॉक्टर के पर्चे पे लिखी है वो सिर्फ एक ही पेशेंट के लिए जिसके लिए वो प्रिस्क्राइब हुई है, उस मेडिसिन को, उस प्रिस्क्रिप्शन को कोई और यूज नहीं कर सकता. दिस इज इल्ला. नेक्स्ट प्लीज.
Ronak sir, next slide, please.
यस, क्वेश्चन यहाँ पे आता है कि ड्रग एब्यूज है क्या. कोई भी मेडिसिन जब मार्केट में आती है या कोई भी फार्मा कंपनी उसको बनाती है, उसका एक ही पर्पस होता है, मेडिसिनल यूज, टू ट्रीट ए पेशेंट. पर जब वो दवाई नॉन मेडिसिनल यूज के लिए शुरू हो जाती है, उसको हम बोलते हैं प्रिस्क्रिप्शन ड्रग एब्यूज. मीन्स अगर कोई भी हम मेडिसिन, यूज ऑफ ए मेडिकेशन विदाउट ए प्रिस्क्रिप्शन कर रहे हैं, बिना डॉक्टर की प्रिस्क्रिप्शन कर रहे हैं, हम केमिस्ट शॉप पे जाते हैं, हमको बोलते हैं भैया कोरेक्स सिरप दे दीजिए, या कोडिन सिरप दे दीजिए, या हिप्नोटिक सेडेटिव दे दीजिए, या किलर दे दीजिए. जितनी भी ये दवाइयां हैं जिनसे नींद आती है, जिनसे नशा होता है, जिनसे डिप्रेशन होती है, जो बिना डॉक्टर के पर्चे के आप यूज करते हैं, दिस कैन लीड टू प्रिस्क्रिप्शन ड्रग एब्यूज इन ए वे अदर देन एज प्रिस्क्राइब. हायर डोजेज हम उसको ले रहे हैं, अमाउंट ऑफ ड्रग इन दी डिसअप्रूव्ड मैनर ले रहे हैं, तो दिस इज कॉल्ड ए ड्रग एब्यूज बाय डिफरेंट रूट्स ऑफ एडमिनिस्ट्रेशन. नाउ सी, जब भी हम कोई मेडिसिन लेते हैं, नॉर्मली हम उसको ओरल रूट से लेते हैं, समटाइम्स हम उसको इंजेक्शन फॉर्म में लेते हैं, समटाइम हम उसको कैप्सूल फॉर्म में लेते हैं. बट when we take this medicine by different routes of administration, particularly in the form of injections, it is a prescription drug abuse, particularly जब हम उसको नशा कर रहे हैं, and combined with alcohol or other drugs. You go to so many parties. अभी जो मीडिया में दिखाया गया केस में, ड्रग एडिक्शन के केस में, on the farmhouse the parties are going on, at the celebrities house residence parties are going on. They were using alcohol. They were using alcohol along with some drugs, combining with the alcohol. So all these are prescription drug abuse, which is to be stopped. Next, please. अब सबसे बड़ा इंपॉर्टेंट इशू है, डेंजर्स क्या है प्रिस्क्रिप्शन ड्रग एब्यूज के. अगर हम ड्रग एब्यूज में पड़ जाते हैं तो सबसे पहले क्या होता है, वी बिकम ड्रग एडिक्ट. एंड ड्रग एडिक्शन इज ए बिग चैलेंज. पर्टिकुलरली आई एम requesting all the young students who are attending this webinar, we have to avoid drug addiction at any cost. We should not go for drug addiction. Change in normal behavior. जब हम drug addiction करते हैं, हमारा normal behavior नहीं होता है. Our system changes. Our nervous system works in a different way. So this is a change in normal behavior. हमारी डिस्टर्ब फैमिली हो जाती है, हमारी ऑफिशियल लाइफ डिस्टर्ब हो जाती है, हमारी सोशल लाइफ डिस्टर्ब हो जाती है. कितना बड़ा खतरा है अगर हम ड्रग एडिक्शन करते हैं. 1 death every 15 minutes from accidental overdoses. Once आपने सुना होगा कंबाइनिंग ड्राइविंग एंड ड्रिंकिंग. कितने हम मीडिया में सुनते हैं कि इसका डेथ हो गया, एक्सीडेंट हो गया, ड्रिंक करके ड्राइव कर रहे थे, लाइक दैट. सो 1 death every 15 minutes from accidental doses. राइज इन हॉस्पिटल इमरजेंसी. हॉस्पिटल इमरजेंसी में केसेस बढ़ जाते हैं. And more deaths from accidental drug overdose than the car accident. This is very important. जब आदमी ड्रग एडिक्शन करता है या ड्रग एब्यूज करता है, नशा करता है, तो उसके चांसेस जो हैं फेटल होने के ज्यादा हैं एज कंपेयर टू कार एक्सीडेंट. तो वी हैव टू बी वेरी केयरफुल. नेक्स्ट प्लीज. अब कारण क्या है, लोग प्रिस्क्रिप्शन ड्रग एब्यूज में पड़ क्यों जाते हैं? यंग जनरेशन गेटिंग हाई फॉर द एक्सपीरियंस. For example, if I smoke, I will request my friend, you also smoke. I am taking nicotine, I request my friend to take nicotine. Simple example is hookah bars. Now, these hookah bar concept in the entire country is very dangerous, I am telling you. So all the young students has to take care, because once you go to these hookah bars, taking hookahs and inhaling that vapors, this is addiction. Use is for recreational purpose, not for medical purpose. This is why people go for drug abuse. जब पेन होता है, एंग्जाइटी होती है या अलर्टनेस हमको बढ़ानी होती है, हम सोचते हैं यार पेन किलर खा लें, या एंग्जाइटी बढ़ रही है उसको रोकने के लिए हम समय ले लें. So all these are the issues which are causing the prescription drug abuse. Peer pressure, then easy access, क्योंकि ये मेडिसिन बिना पर्चे के डॉक्टर की केमी शॉप से मिल जाती है. We can easily get this medicine. Access is very easy. This is one of the reason. Thinking that they are not harmful. हमें लगता है यार एक मेडिसिन ले लेंगे या सेल्फ मेडिकेशन कर लेंगे या एक सिगरेट पी लेंगे या एक बार हुक्का बार चले जाएंगे या एक बार निकोटीन ले लेंगे तो लगेगा कि यार ये हार्मफुल नहीं है. बट दे आर वेरी, देयर इज अ डिस्टर्बेंस गोइंग ऑन, आई थिंक ऑन द बैकग्राउंड, सम डिस्टर्बेंस. हेलो.
Yes, sir. We can hear also. Students, you are requested to mute yourself.
Thinking. Some voice is coming. Some voice is coming from background.
Mr. Ronnie, please switch off your mic. रौनक सर इनको एक्सपेल कर दीजिए फिर इसमें से.
So
We are doing that.
Thank you, ma'am.
No, thinking that they are not harmful. तो हम सोचते हैं कि वो अगर हम ले भी लेंगे मेडिसिन तो हार्मफुल नहीं होगी, लेट अस ट्राई. Then no risk of penalty or लगता है कि कोई पेनल्टी नहीं है या अरेस्ट नहीं है. But you have seen the cases. So many people are being arrested in Mumbai. Narcotic Control Bureau Department is working very hard to see who are the people who are involved in the drug addictions or supply of drugs and lack of awareness. So all these are the issues the people when they go for the abuse of prescription drugs. So we have to be very careful. Next. Now in this slide I have shown some of the commonly abused prescription drugs. कौन सी commonly used prescription drugs हैं? Opioids. मैंने अभी आपसे डिस्कस किया फेंसिडिल सिरप के बारे में या कोरेक्स सिरप के बारे में, which contains codeine as one of the active ingredient. Now this codeine or morphine and the related drugs which are covered under the definition of narcotic, they are one of the dangerous drugs if we use without the guidance of a doctor. Central nervous system depressants, painkillers, medicines which are used to induce sleep, like diazepams, clonazepams, lorazepams, benzodiazepines. These are the second category of the medicines which are acting on the central nervous system, and they are the depressants. Some of the drugs which are stimulants, for example, amphetamines and related drugs. So these are some of the categories I have shown of the medicines or drugs which are commonly used as the causing addiction, and if you are taking this medicine without the consultation of a doctor or a registered medical practitioner. Next please. कारण क्या है ड्रग एडिक्शन का बढ़ने का? व्हाट इज द रीजन? सबसे पहले आई कैन से फिजिशियन, उसको पास पेशेंट का प्रॉपर डाटाबेस ही नहीं है. इफ ए पेशेंट गोज टू ए डॉक्टर, as a patient he will tell what he has taken, what is his past history, and doctor has to treat the patient to prescribe the medicine according to the history being being detailed by a patient. So physician and the patient has to play a very important role once they are interacting with each other. Pharmaceutical industry, और यहाँ क्या है कि pharmaceutical industry चाहती है हमारा प्रोडक्ट बिके, चाहे वो एथिकल हो चाहे अनएथिकल प्रमोशन हो, बट companies want that their product should be having on the maximum sale of particular drug. Consumer patient using leftover medicines, घर में कोई मेडिसिन बच गई, अब वो रिक्वायर्ड नहीं है, we start taking the medicine of our own, or we can go for self medication. Pharmacist, unethical dispensing. Pharmacist has to play a very important role not to dispense any drug to any of the consumer, to any of the patient without the prescription of a doctor. और कोई भी केमिस्ट शॉप पे कोई आदमी चला जाता है कि मुझे कोरेक्स सिरप दे दीजिए, या मुझे पेन किलर दे दीजिए या मेरे को एंटी डिप्रेसेंट मेडिसिन दे दीजिए और उसके पास डॉक्टर का पर्चा नहीं है, और अगर केमिस्ट उसको बिना पर्चे के वो दवाई दे देता है, दिस इज कॉल्ड अनएथिकल डिस्पेंसिंग, विच इज वायलेशन अंडर ड्रग्स एंड कॉस्मेटिक्स एक्ट. Society, peer pressure, and not medical advice. So this peer pressure and non-medical advice is one of the major reasons for the rise in the drug addiction or drug abuse. Next. यहाँ पे मैंने कुछ सिम्टम्स दिखाए हैं, आप देखिए स्लाइड में कि प्रिस्क्रिप्शन ड्रग एब्यूज होने से सिम्टम्स क्या होते हैं. इंक्रीज इन ब्लड प्रेशर एंड हार्ट रेट. I quote here one example, which is a very shocking data that WHO has given, that most of the young generation in the country is suffering from hypertension and diabetics. Now this hypertension, that is increased pressure, or diabetic, that is sugar, at a young age is very alarming. We have to be very careful. So this is one of the reason of prescription drug abuse: increased blood pressure or heart rate, damage to brain and other organs. So if we are taking drugs and we are addict, it can damage the brain and the other part of the body, leads to the accidental overdose and poisoning, causes physical dependency and addiction, disrupted breathing, that is respiratory depression, and causes seizures and even death. तो आप देखिए कितने इसके सिम्टम्स हैं, कितना ये डेंजरस है अगर हम प्रिस्क्रिप्शन ड्रग एब्यूज करते हैं या ड्रग एडिक्शन पे चले जाते हैं. नेक्स्ट प्लीज. व्हाट आर दी रिस्क फैक्टर फॉर एडिक्शन? नाउ सबसे पहले मैंने यहाँ एग्जांपल दिया फैमिली का. फैमिली प्लेज ए वेरी इंपॉर्टेंट रोल. Even mother, even father, even brothers, even sisters. Now, if in my family my father smokes, normally chances that this son will start smoking. If my father drinks, seeing my father, I start drinking. So this family history is very important. Parents have to understand what they have to do, they have not to do in the presence of their children. And again, the children has to understand that seeing their parents or seeing their father and mother, they should not go for any such habit which is harmful for their lives. Gender, it is more common in males. मैं ये नहीं कहता हूँ कि फीमेल्स पे नहीं है, but if you see smoking, alcohol, hookah bars, drugs, it is more common in the males as compared to females. Peer pressure, just enjoyment. Psychiatric illness, psychiatric illness is one of the risk factor. If I am not well, I am depressed, I am under going to a psychiatrist. So this psychiatric illness is one of the factor for the addiction of drugs. Lack of family involvement, again I have told family history and lack of family involvement. अगर फैमिली के पेरेंट्स, फैमिली के मेंबर्स पूरा कंट्रोल नहीं करेंगे बच्चे की लाइफ के लिए, उनके कैरियर के लिए, तो दिस इज वन ऑफ द मेजर इश्यू. टेकिंग ए हाईली एडिक्टिव ड्रग, अगर हम हाईली एडिक्टिव ड्रग स्टार्ट कर लेते हैं ऑफ आवर ओन without the consultation of a doctor, without consulting any registered medical practitioner, so this is one of the risk factor for drug addiction. Next. Next, please. Now here, हमने एक बहुत बड़ा सर्वे किया. Question is, most people who abuse prescription drug get them from a drug dealer. हमने ये क्वेश्चन सर्वे किया कि जो भी आदमी ड्रग एडिक्ट करते हैं या जो भी लोग ड्रग एडिक्शन में इन्वॉल्व हैं, उनको ये ड्रग्स मिलती कहाँ से हैं. आप देखिए ऊपर मैंने एक फोटो दिखाया है. सम पर्सन इज गिविंग ड्रग एंड ही इज एक्सेप्टिंग मनी. बट क्वेश्चन इज ये ड्रग्स आती कहाँ से हैं, कौन रिस्पॉन्सिबल है इसके लिए. नाउ सी द नेक्स्ट स्लाइड प्लीज. Now see this slide. This is very important slide. हमने जब सर्वे किया तो हमने ये पाया कि 70% of the people who abuse prescription medicine, they get them from a friend or a relative. आप देख लीजिए, this is very very true. 70% of the people who abuse prescription medicine, they get them from a friend or a relative. 70% आप देख लीजिए, this is very very true. या किसी दोस्त से या किसी रिश्तेदार से। और अभी आपने फिल्म इंडस्ट्री का मुंबई का सीन देख लिया, मीडिया में देख लिया कि वेदर इट वाज रिया चक्रवर्ती और एनी ऑफ फेमस हीरोइन और सेलिब्रिटी, उनको ड्रग्स कहाँ से मिल रही थी? अपने फ्रेंड सर्कल से या अपने रिलेटिव सर्कल से। सो एज ए ट्रू फ्रेंड, as a best true relative, as a best friend, we have to see what we have to do, what we have not to do. We should not misguide our friends. We should not misguide our relatives. ये नहीं कि अगर मैं ड्रिंक कर रहा हूँ तो आई शुड टेल माई फ्रेंड यार एक बार आप पी लीजिए। इफ आई एम स्मोकिंग देन आई शुड से माई फ्रेंड यार एक बार स्मोक कर लीजिए। या इफ आई एम टेकिंग ड्रग्स आई टेल माई फ्रेंड एक बार ट्राई कर लीजिए। जस्ट पीयर प्रेशर। So this is the survey. 70% of the people who abuse prescription medicine get them from a friend and a relative. This is the reality. So as a friend, as a good relative, you have to play a very important role in preventing the drug addiction. Next slide, please. So here, this is my department. Hamara as a pharmacist, I'm into regulation. I'm the controller of drug in Delhi, but basically my qualification is I'm a pharmacist. And all the pharmacists has to play a very important role. What they have to do? Be the first line defense in recognizing the prescription drug abuse. अगर आपके पास कोई भी डॉक्टर का पर्चा लेके आ रहा है, तो just check it. ये मेडिसिन जो आप डिस्पेंस करने जा रहे हैं, ये उसके लिए बेनिफिशियल है कि नहीं है? Review the profile of the patient who are chronically taking the controlled substance. Controlled substance मैंने अभी एग्जाम्पल बताया आपको, codeine, alkaloids, amphetamines. So all these are the controlled substance. So morphines. तो अगर आपके पास कोई पेशेंट बार बार फ्रिक्वेंटली आ रहा है तो आप चेक करिए कि ये जो कंट्रोल्ड सब्सटेंस है विच इज टू बी सोल्ड ऑन द प्रिस्क्रिप्शन ऑफ ए डॉक्टर, ये हैबिचुअल तो नहीं ले रहा है। जो डिटेक्ट फ्रॉडुलेंट प्रिस्क्रिप्शन, अगर कोई डॉक्टर का प्रिस्क्रिप्शन गलत है तो एज ए फार्मासिस्ट आपको चेक करना है कि प्रिस्क्रिप्शन सही है कि गलत है। अडॉप्ट प्रिस्क्रिप्शन ड्रग मॉनिटरिंग प्रोग्राम, तो जितना भी प्रिस्क्रिप्शन ड्रग मॉनिटरिंग प्रोग्राम है उनको फॉलो करना है। बिगिन इंडिविजुअल काउंसलिंग, ग्रुप और फैमिली काउंसलिंग। देखिए, जो बंदा साइकेट्रिक इल है, जो ड्रग एडिक्ट है, जो मेंटली डिस्टर्ब है, ही नीड्स ए काउंसलिंग. So in that case, you have to start counseling. Either it can be a group counseling or an individual counseling or a family counseling, so that he be away from drugs. Suggest medication for treatment or suggest de-addiction center. In our country, there are so many de-addiction centers where the people who are drug addict, they are being treated there, they are being motivated there, they are being counseled there, so that they should avoid addiction. Participate in substance education and prevention programs. हमें प्रोग्राम्स ऑर्गेनाइज कर रहे हैं पर्टिकुलरली उन लोगों के लिए, पर्टिकुलरली उन यंग जनरेशन के लिए जो ड्रग एडिक्शन में इन्वॉल्व है. एंड फार्मासिस्ट हैव a major role in reducing the negative effects that substance abuse has no society, health, substance use has on health society, health system and pharmacy profession. So as a pharmacist, this is our moral duty to guide, to counsel, to educate each and everyone so that the drug addiction is to be stopped. Next. यहाँ मैंने कुछ सुजेस्टिव अप्रोच बताई है कि क्या क्या हम कर सकते हैं. हमें पर्सन ड्रग मॉनिटरिंग प्रोग्राम करना चाहिए जो हमारा डिपार्टमेंट करता है. पेशेंट रिव्यू एंड रिस्ट्रिक्शन प्रोग्राम शुड बी देयर. पेशेंट्स का रिव्यू होना चाहिए, रिस्ट्रिक्शन प्रोग्राम होने चाहिए. लॉज रेगुलेशन पॉलिसीज वेरी स्ट्रिक्ट होनी चाहिए. जैसे आपने देखा नार्कोटिक कंट्रोल ब्यूरो इज वर्किंग वेरी हार्ड एंड पेनल्टी इज वेरी स्ट्रिक्ट. क्लिनिकल गाइडलाइंस होनी चाहिए, सबको बताना चाहिए कि इसका क्या फायदा है क्या नहीं है. सर्विलेंस बढ़ाना चाहिए कि कौन सी सोसाइटी में, कौन से एरिया में, किस जगह पे ड्रग एडिक्शन बहुत ज्यादा है. रेगुलेशंस को और स्ट्रॉन्ग करना चाहिए. क्लिनिकल प्रैक्टिस को, डॉक्टर्स को अपनी प्रैक्टिस को इंप्रूव करना चाहिए. ऑलमोस्ट अवेयरनेस इतनी स्ट्रॉन्ग होनी चाहिए कि एवरीबॉडी शुड नो व्हाट इज राइट एंड व्हाट इज रॉन्ग. नेक्स्ट. So be smart. Here is my submission advice to all of you. Only use prescription or OTC medication as directed by your medical professional. बिना डॉक्टर की सलाह के कभी भी कोई दवाई मत लीजिए. दैट इज वेरी वेरी इंपॉर्टेंट. नेवर शेयर योर मेडिकेशन. अगर कोई डॉक्टर ने आपको कोई मेडिकेशन लिखी है फॉर एनी ऑफ द इलनेस, नेवर शेयर योर मेडिकेशन विद अदर मेंबर्स, फ्रेंड्स और फैमिली और रिलेटिव्स. अवॉइड सेल्फ मेडिकेशन. दिस इज वेरी इंपॉर्टेंट. देखिए, WHO ने डाटा दिया कि पूरी कंट्री में, पूरी वर्ल्ड में एंटी माइक्रोबियल रेजिस्टेंस बढ़ रहा है. Why antimicrobial resistance? Because antibiotics are not effective on our body. So this is one of the reason of self medication. तो हमें सेल्फ मेडिकेशन को अवॉइड करना है, चाहे वो एंटीबायोटिक्स हो, चाहे वो स्टेरॉइड्स हो, चाहे वो पेन किलर्स हो, चाहे वो सेंट्रल नर्वस सिस्टम एक्टिंग ड्रग्स हो, चाहे वो लाइफस्टाइल डिजीज की ड्रग्स हो, चाहे वो कोडीन प्रिपरेशन हो, चाहे वो मॉर्फिन एंड डेरिवेटिव्स हो. अवॉइड सेल्फ मेडिकेशन. एंड यस, डिसमिस द प्रेशर. दिस इज इम्पोर्टेंट. हमारा पूरा वर्ल्ड आज कोविड से सफर कर रहा है. एंड यू आर सीइंग नंबर ऑफ केसेस ऑफ कोविड आर कमिंग. Immunity level is going down. So if we are under tremendous pressure, if we are under, we are not, comfortable, if we are not enjoying our life, our immunity is going down and down and down. And my advice to all of you, please be happy, dismiss the pressure, so that your immunity level should be on the upper side. That plays a very important role. And of course, manage your lifestyle. Why I am saying this lifestyle? Because I have told, WHO has given a data. Young generation is suffering from diabetic. Young generation is suffering from hypertension. आज कैंसर के कितने केसेस आ रहे हैं. एक टाइम होता था कैंसर बहुत रेयर केसेस लोगों को होता था, बट number of cases, all the hospitals in country are full of cancer patients. So whether it is a cancer, whether it is a hypertension, blood pressure, whether it is a diabetic, all these lifestyle diseases are affecting our system, and we have to play a very important role. We have to manage our lifestyle, what we have to do, what we have not to do. This is important. And my request to all of you, all young students sitting here attending this webinar, please try to spend some time, 30 minutes, 40 minutes, 20 minutes, for doing some morning exercise, or by doing some meditation, by doing some yoga, some physical exercise. So this will prevent you from all these, lifestyle disease. Prescription drugs can help us live a longer and healthier life, but only if they are used properly under the medical supervision. Again, I am repeating, कोई दवाई कंट्री में आती है, that is always for preventing a disease. But हम जब उस दवाई को पर्टिकुलरली सेल्फ मेडिकेशन के यूज में, पीयर प्रेशर को रिमूव करने के यूज में, एंजॉयमेंट के यूज में शुरू कर देते हैं, तो इट to use each and every medication under the supervision of a doctor. Next slide, please. आप देखिए यहाँ पे मैंने दो ब्यूटीफुल फेसेस हैं, एंड यू कैन से लाफ्टर इज द बेस्ट मेडिसिन. अगर हम स्माइल करेंगे, हम खुश रहेंगे, हम प्रेशर को रिलीव करेंगे, तो डेफिनेटली हमारा इम्यूनिटी सिस्टम बढ़ेगा और वी आर सेफ फ्रॉम ऑल डिजीज. So this is my message to all of you, that keep smiling, be happy, remove tension, remove stress, do positive things, be positive, no negativity, and try to do your best, and success is there. So with these remarks, next please. Next slide please. So these remarks, I can simply conclude my presentation. Say no to prescription drug abuse and say yes to life. This is important. And here I can add one thing more. I can tell you, during this COVID time, when this COVID was announced, in the month of March 2020, entire world is suffering as on date. Pandemics आते रहेंगे, pandemics जाते रहेंगे. We can see the past, history. Swine flu, Asian flu, chicken pox, HIV, AIDS, all this pandemic जो भी आए, थोड़ा सा सिस्टम हिला, प्रेशर हुआ, बट एट द एंड ऑफ द डे everything was well set. Medicines were available. Even for COVID-19, you need not to worry. You have to follow all the guidelines being issued by different Indian Council of Medical Research, Ministry of Health and Family Welfare, from Drugs Control Department, from Department of Pharmaceuticals, and try to follow these guidelines. अभी अभी इतना हमें लिबर्टी नहीं मिली है कि we can start enjoying our life by not maintaining social distance, by not wearing the mask, by not washing our hands. So try to follow all the guidelines very strictly, follow all the advisories from the different departments which are coming from time to time, and you are totally safe. But be positive, increase immunity. Life is very good. And I tell you, the most of the pharmaceutical companies are trying their level best to introduce a vaccine which can be used in the treatment of COVID, and we are expecting one of the good by early 2021, by say before March. So before March, if we are getting some vaccine which can cure the COVID or which can treat the COVID-19, we are well set. So we need not to worry. Everything will be all right. So my message to young students, particularly the hotel management students, who are doing the wonderful course. Hospitality line is one of the best line nowadays. Due to COVID, some sort of system hila hua hai, but anyway, future is very good. So my advice to all of you, particularly in the case of hygiene, particularly in the case of eating habits. दवाई कौन खाता है? जब खाना प्रॉपर नहीं खाया, या हमारी ईटिंग हैबिट्स प्रॉपर नहीं है, या क्वालिटी फूड नहीं है. So you have to play an important role by providing quality foods, by maintaining the hygienes, by educating each and everyone. And you are the people for food, we are the people for drugs. So it is a combined regulation, food and drug administration. But definitely, as a healthcare provider, I can say as a COVID warrior, we are trying our level best to see that each and everyone should be happy and there should not be any problem to anyone in the country. With these remarks, thank you very much, and I request you to stay safe and take care. Namaste to all.
Thank you, Mr. Atul. Mr. Nasa will now be taking a few questions.
Yes,
So kindly
yes,
put your questions on the chat box itself.
Yes, any question, please?
So the first question we have for you is, how drug abuse leads to a diabetic patient?
मैंने पहले भी बताया डेंजर्स ऑफ ड्रग एडिक्शन. नाउ जब भी हम कोई भी ड्रग एडिक्शन स्टार्ट करते हैं, इट नॉट ओनली इफेक्ट्स द ब्रेन, इट इफेक्ट्स एंटायर बॉडी. Now, whether it is a respiratory system or a digestive system or the urinary system, kidneys are affected, liver are affected, pancreas are infected. So, drug addiction can lead to any of the lifestyle disease. So this is one of the factors. We should not go for drug addiction, and particularly diabetic patient, or if a person who is having the diabetic, he has to be very careful by not taking alcohol, by not taking the nicotine, and by not taking the related preparations.
Thank you, sir. The next question we have for you is, how can peer pressure lead to prescription drug abuse?
See, peer pressure means we want to relieve pressure, we want to go for enjoyment. Now, suppose in case I have taken some of the drug for enjoyment or for the peer pressure, so I become habitual of taking that drug. Simple example I have taken here is codeine preparations. Now, this codeine preparation, that is fancy deal or the Corex syrup, this is mainly containing the antihistaminics, and these antihistaminics are affecting on the nervous system to give you relief from the cough and the cold. But once we take this codeine preparation for enjoyment, for removing the pressure, it becomes drug addiction. And we have seen most of the college students, and we have seen the outside campus, empty bottles of codeine preparations lying outside. If I go for a morning walk, I have seen in the morning walk in the park these empty bottles of Corex and Penicillin lying. It means some people, whether they are drug addicts or just they are, young generation, they are trying to use these medicines for peer pressure.
Thank you, sir. So the next question we have for you is depression curable without pills
Definitely,
and drugs? Is
definitely,
depression curable?
definitely, depression is totally curable. It requires simply counseling. It simply requires our mind thinking. And simple thing is, I should say, if I am depressed, I am not well. It is not a disease. And we can, psychiatry, it is, if you go to a doctor, it is a psychology which treat the patient. अगर आप किसी डॉक्टर के पास जाते हैं एंड डॉक्टर आपसे 5 या 10 मिनट अच्छी से बात कर लेता है तो 50% you are recovered. So depression can be definitely treated without drugs also, but if it is a chronic case, then start with a small medication, and if still it is not cured, then you can increase the dose. That's all. But it is totally curable.
Thank you, sir. So the next question we have for you is, if weed is so bad, then why do so many Western countries legalize it?
Which one? What is your question?
Sir, if weed is so bad, then why do so many Western countries legalize weed?
See, it all depends upon the total factors of the country's populations. Apart from the other factor is how the regulations are there. Now, so you see, in our country, population of our country is huge. We are in crores. If we compare our population with the population of United States of America or Australia or Canada, so it all differs from the various factors involving in the economy of the system. And if it is legalized, now legalized maybe are we able to control or we are not able to control a system? So if we are going to legalize something, we have to see by after legalizing, can we control it or not? And if we are not able to legalize or we are not able to control, then we have to simply cut it off. So all total depends upon the system of a country, its economy, its population, its environmental factor, and its regulations. So all these factors are internally associated.
Thank you, sir. So I think we have time for one more question. So the
Yes.
question is, why doesn't the government control the production of nicotine and alcohol if it's so bad for a countryman?
See, I tell you, nicotine or the alcohol, for production is always controlled. It is not that production is not controlled. But selling of nicotine or selling of alcohol, excise department is getting a lot of revenue from the, by selling alcohol. But if you go to a wine shop or a, whiskey shop, it is written that person below 25 years of age is not allowed. If you go to a smoking, this shop, it is written, a board is displayed. Smoking is injurious to health, and a person below 25 years of age or 21 year of age is not allowed to use smoking. So government is giving guidelines, but we have to strictly follow it. If we are deviating from the guidelines, definitely we'll see. I'm not saying that smoking is good for health or not good for health. But if you, simple example I take here, tea. Now tea contains caffeine. Caffeine is also an alkaloid. Cigarette contains nicotine. Nicotine is also an alkaloid. But if you take tea, chai जो हम पीते हैं, right from morning till evening, we take number of cups. So taking number of cup of tea, taking excess quantity of caffeine is called addiction. Similarly, nicotine. Now nicotine, if you take in the excess quantity, it is addiction and harmful. And similarly is alcohol. I tell you, alcohol is the best medicine for cardiac system. It is the best vasodilator. But quantity of the alcohol is to be restricted. It should not be 30 to 60 ml. That's all. But once people start taking alcohol, the quantity is, God knows how much they take and they want to enjoy. So excess of everything is bad, whether it is a nicotine or alcohol or caffeine or any other product.
Thank you, Mr. Nasa. So thank you for answering the questions. Now, on behalf of IHM Pusa, I'd like to express my heartfelt gratitude and respect for our distinguished speaker, Mr. Atul Nasa, for gracing us with your presence and enlightening us with a commendable talk on such a delicate and not often enough talked about subject matter. For making progress in any kind of area, it's very important that we have an open, free, open discourse about it. And I'm sure that the message that you delivered today will ingrain an admirable acumen in our students. Thank you, sir. We'll now be taking
Thank you very much.
break. We'll now be taking a quick break and we'll see you soon for the second session of the day, which starts at 11:30. You are required to join 15 minutes before the session time.
Thank you so much, sir. Thank you so much for your valuable
Thank you.
time.
Most welcome. Most welcome.
Right, sir. Thank you, sir.
Thank you, sir. Thank you very much.
Thank you.